Only 1% of people know the true impact of baking soda. Did that innocent box of baking soda in your kitchen cabinet just kill someone last week? It sounds shocking, but emergency rooms across the country regularly treat people who've misused this common household item with life-threatening consequences. Today, I'm revealing the hidden powers and dangers of baking soda that pharmaceutical companies don't want you to know about. By the end of this video, you'll understand exactly how to use this $1 powder to potentially transform your health, and why using it incorrectly could send you to the hospital. Let's start with something truly remarkable about baking soda that most doctors won't tell you. This simple substance has been shown to neutralize acid so effectively that it can actually slow the progression of kidney disease by up to 67% in certain patients. How is this possible? Your kidneys naturally regulate your body's acid-base balance. When they become damaged, acid builds up in your bloodstream, creating a vicious cycle of further kidney damage. Baking soda, chemically known as sodium bicarbonate, neutralizes this excess acid, potentially taking enormous pressure off struggling kidneys. In a landmark study published in the Clinical Journal of Nephrology, researchers followed patients with advanced kidney disease for 2 years. Those receiving daily sodium bicarbonate supplements showed dramatically slower disease progression. Their kidney function declined at a rate 2/3 slower than those not taking baking soda. Even more remarkably, their hospitalization rates dropped by nearly 30% compared to the control group. The exact therapeutic dose used in these studies was 600 to 1,200 milligrams daily, about 1/8 to 1/4 teaspoon, carefully monitored by nephrologists to prevent side effects. This is significantly less than the amount many people self-administer for heartburn relief. Researchers at the American College of Sports Medicine discovered that consuming a small amount of baking soda before intense workouts can boost athletic performance by up to 24%. Elite athletes have been using this legal performance enhancer for decades, while keeping it relatively quiet from competitors. During high-intensity exercise, your muscles produce lactic acid. That's what causes the burning sensation as you push your physical limits. Baking soda acts as a buffer, neutralizing this acid and allowing your muscles to work harder and longer before exhaustion sets in. The performance-enhancing protocol used by Olympic athletes is precisely calculated. 0.3 grams per kilogram of body weight, about 1 teaspoon for a 150-pound person, consumed in solution 60 to 90 minutes before high-intensity exercise. Taking it closer to exercise often causes digestive distress that outweighs the performance benefits. But now, let's assume the following scenario. You start taking baking soda daily without understanding the proper dosage. What happens next might terrify you. Your body maintains blood pH within an extremely narrow range, between 7.35 and 7.45. Even small deviations outside this range can have profound effects on your health. When baking soda disrupts this balance, you can develop metabolic alkalosis, a condition where your blood becomes too alkaline. The symptoms begin subtly, perhaps some nausea, irritability, or muscle twitching. But as alkalosis progresses, muscles begin twitching uncontrollably, confusion sets in, and in severe cases, seizures or coma can follow. Just 2 tablespoons consumed too quickly could trigger this potentially fatal condition in susceptible individuals. Medical records show that alkalosis from baking soda ingestion has a mortality rate of up to 10% when severe enough to require hospitalization. Most concerning, Approximately 30% of these cases occurred in people attempting to treat simple heartburn or indigestion with baking soda. What makes this particularly dangerous is that the early symptoms can be easily dismissed or attributed to other causes. By the time severe symptoms develop, you might already be in serious trouble. What's even more concerning is how baking soda interacts with the medications millions of Americans take daily. Let me share something that might save your life. Baking soda can reduce the effectiveness of antibiotics by up to 50%, while dangerously increasing the absorption of amphetamine-based drugs to toxic levels. When baking soda dramatically alters pH levels, the medication may not work as intended. For example, certain antibiotics form chemical complexes with the sodium in baking soda, preventing their absorption in the intestines. This means people taking medications for heart conditions, seizure disorders, mood disorders, or infectious diseases could be unknowingly sabotaging their treatment by consuming baking soda. The drug interactions are particularly dangerous with aspirin and other salicylates, reduced effectiveness, ACE inhibitors for blood pressure, dangerous potassium depletion, lithium, increased blood levels potentially reaching toxic range, quinolone antibiotics, reduced absorption by up to 50%, antacids containing aluminum, increased aluminum absorption. Now let's explore the third extraordinary benefit that Big Pharma doesn't want to become common knowledge. Groundbreaking research from the Medical College of Georgia found that baking soda triggers a powerful anti-inflammatory response in the body by signaling special immune cells to calm down inflammatory pathways. The mechanism involves mesothelial cells that line your internal organs. These cells detect the subtle pH shift from baking soda and signal immune cells called macrophages to switch from promoting inflammation to reducing it without suppressing immune function against actual threats. This selective anti-inflammatory effect is what makes baking soda so unique compared to pharmaceutical options. For people suffering from autoimmune conditions like rheumatoid arthritis, lupus, or psoriasis, this discovery opens fascinating possibilities for symptom management. Some study participants reported significant reduction in joint pain and stiffness after just 2 weeks of controlled baking soda consumption. And here comes the most surprising breakthrough of all: baking soda's potential role in cancer treatment. Recent studies suggest that cancer cells thrive in acidic environments, and researchers have found that increasing tumor pH with sodium bicarbonate enhanced the effectiveness of certain chemotherapy drugs while inhibiting metastasis in animal models. What makes this particularly significant is that cancer cells actively create acidic microenvironments to protect themselves and promote their growth. The median pH around tumors is often 6.5 to 6.9, significantly more acidic than normal tissue. Research published in Cancer Research demonstrated that neutralizing this acidity with sodium bicarbonate reduced tumor growth by 30% and metastasis by over 40% in certain cancer models. Let's be absolutely clear, this is preliminary research, and baking soda should never replace conventional cancer treatments. But wait, before you start self-medicating with this powerful substance, you need to understand the fourth serious danger that most people remain completely unaware of. When baking soda reacts with stomach acid, it produces carbon dioxide gas. If too much baking soda is consumed too quickly, the resulting gas production can be excessive. In documented medical cases, excessive baking soda consumption has led to stomach rupture from this gas buildup, a condition with a staggering 30% mortality rate. This risk increases significantly if baking soda is consumed after a large meal when the stomach is already full, or if there's any obstruction in your digestive tract. Gastric rupture from baking soda typically occurs with doses exceeding 1 tablespoon taken all at once, particularly after heavy meals. What makes this particularly treacherous is that people often take more baking soda when their initial dose doesn't provide relief, compounding the danger exponentially. The fifth benefit focuses on oral health beyond just whitening. The alkalinity of baking soda disrupts bacterial biofilms that cause tooth decay, gum disease, and bad breath. Studies in the Journal of Clinical Dentistry found that toothpastes containing baking soda were significantly more effective at removing plaque and reducing gingival inflammation than regular toothpastes. The antibacterial effect is particularly powerful against S. mutans and P. gingivalis, two bacteria most responsible for tooth decay and gum disease. Even more impressive, baking soda penetrates deeper into periodontal pockets, the spaces between teeth and gums where disease-causing bacteria hide, than commercial antimicrobial rinses, accessing areas where conventional treatments often fail. But now I must warn you about the silent danger to your bones. Long-term, regular consumption of baking soda may lead to calcium and magnesium depletion from your skeletal system. When your body constantly compensates for alkaline substances, it pulls these minerals from your bones to maintain proper pH balance. Over time, this mineral leaching could potentially contribute to reduced bone density and increased fracture risk. In a 5-year observational study tracking regular antacid users, those who consumed alkalizing agents like sodium bicarbonate showed a 15% greater decrease in bone mineral density compared to non-users. This effect was most pronounced in postmenopausal women and those with low dietary calcium intake. The seventh danger affects your digestive system in ways few people anticipate. While occasional baking soda might help with heartburn, regular use can lead to something called acid rebound, where your stomach actually produces more acid than before. When you repeatedly neutralize acid with baking soda, your body compensates by producing even more acid, often more aggressively than before. Many gastroenterologists report seeing patients caught in this vicious cycle, where they become dependent on increasing amounts of antacids, while their underlying condition actually worsens. Even more concerning, baking soda can mask symptoms of serious conditions like Barrett's esophagus or even early-stage esophageal cancer, delaying diagnosis when treatment would be most effective. Gastroenterologists estimate that acid-suppressing treatments delay diagnosis of upper GI cancers by an average of 3.5 months. The eighth benefit relates to urinary tract health and the prevention of kidney stones. For certain types of kidney stones, specifically uric acid stones, slightly alkalizing the urine with properly diluted baking soda can help prevent their formation or growth. Uric acid stones form in acidic urine with pH below 5.5 and make up about 10% of all kidney stones. Research shows that raising urinary pH to just 6.5 with sodium bicarbonate can prevent uric acid crystallization by increasing solubility by over 1,000%. For recurrent stone formers, this simple intervention reduced new stone formation by 60% compared to untreated patients. But the ninth danger affects a vital body system, your kidneys themselves. While small amounts of baking soda might benefit some with kidney disease under medical supervision, self-medicating with baking soda when kidney function is compromised can be extremely dangerous. Damaged kidneys may be unable to properly process the additional sodium load and pH changes from baking soda, potentially accelerating kidney damage. For someone with undiagnosed kidney disease, an estimated 15% of American adults, consuming as little as 1/2 teaspoon of baking soda daily could accelerate progression to kidney failure by overloading already struggling kidneys with sodium they cannot properly process. The resulting fluid retention and increased blood pressure compound kidney damage in a dangerous downward spiral. The 10th benefit is related to exercise recovery beyond just performance enhancement. Research suggests that properly timed and dosed baking soda supplementation can significantly reduce post-exercise muscle soreness and accelerate recovery between training sessions. A double-blind, placebo-controlled study published in the Journal of Strength and Conditioning Research found that athletes consuming sodium bicarbonate experienced 27% less muscle soreness following intense resistance training and recovered baseline strength 33% faster than the placebo group. But now we must address the 11th danger: baking soda's impact on blood pressure and heart health. The high sodium content in baking soda, about 1,200 milligrams per teaspoon, can significantly raise blood pressure in salt-sensitive individuals and those with hypertension. Furthermore, the rapid changes in electrolyte balance caused by baking soda can trigger dangerous heart arrhythmias in susceptible individuals. People with existing heart conditions could experience worsening of their condition or even life-threatening events following baking soda consumption. Cardiology research shows that for people with heart failure, consuming just 1 teaspoon of baking soda can increase blood pressure by 5 to 8 millimeters of mercury and significantly worsen edema fluid retention by increasing sodium levels. This seemingly small change can trigger dangerous decompensation, requiring hospitalization. I must also warn you about the potential neurological effects from electrolyte imbalances caused by excess baking soda consumption. Your nervous system requires precise levels of sodium, potassium, calcium, and magnesium to function properly. When baking soda disrupts these balances, it can trigger neurological symptoms ranging from mild to severe, including numbness, muscle cramps, tremors, confusion, mood changes, memory problems, and in severe cases, seizures. The neurological risks are highest when potassium levels drop below 3.0 millimoles per liter, following baking soda consumption, a condition called severe hypokalemia. At these levels, nerve and muscle function become compromised, potentially affecting not just skeletal muscles, but also cardiac muscle and brain function. So how can you safely harness these powerful benefits while avoiding the dangers? Here's what separates the informed 1% from everyone else. Never exceed 1/2 teaspoon dissolved in 4 ounces of water at a time. For athletic performance, take this amount 1 to 2 hours before intense exercise. For digestive support, wait at least 2 hours after eating. Stay well hydrated when using baking soda internally to prevent electrolyte imbalances. For kidney protection, work with a nephrologist who understands baking soda's potential benefits. Certain people should completely avoid internal use. Those with high blood pressure, heart failure, kidney disease, liver disease, edema, or pregnant women. Anyone taking medications should consult their healthcare provider first. Baking soda truly is a remarkable substance with effects on human health that most people have never been told about. Used wisely, this simple white powder could offer extraordinary benefits. Used carelessly, it could lead to serious harm. You now possess information that puts you in the top 1% who truly understand baking soda's impact on human health. This knowledge empowers you to make informed decisions about whether this everyday substance might have a place in your health regimen always with appropriate caution and professional guidance when necessary.